Professionals warn that we have just begun to see how fast COVID-19 can spread.
Health experts say being in close contact makes it easy for coronavirus to move from person to person. Alexis Carpello spoke with an infectious disease specialist in Rockford. He says it's critical that people take actions to flatten the curve.
That's right, Eric and Brittany. As we know, tests in Illinois are limited. Having a peak in infected people is what needs to be avoided. And it's not just the elderly that needs to be cautious.
We must sacrifice together because we are all in this together and we'll come through together.
A message echoed by local infectious disease specialist Dr. Gary Rifkin.
This is a small world, and we only have one world, and we need all of us to help to take care of it.
The virus has mostly been thought to be deadly in elderly people and those with underlying conditions, but now it appears it doesn't discriminate based on age.
There are concerning reports coming out of France and Italy about some young people getting seriously ill and very seriously ill in the ICUs.
Youth tend to think of themselves as invincible. Well, they're not. And in addition to not being invincible, they can be spreaders.
The United States has seen dramatic increases in number of cases. Almost 300 alone are in Illinois, resulting in one death this week.
The difference between where we are in our response and where other nations are is just a few weeks.
Dr. Rifkin says the time is now to flatten the curve, and social distancing will play a key role.
If you were in a room with 100 people and you were coughing and sneezing and everybody was within a few feet of you, it's very likely that you would infect most of those people. And if everybody got sick at the same time, there would be a high spike in people getting ill and going into the emergency rooms and possibly requiring hospitalization and ventilators. We don't want that to happen because that could overwhelm our healthcare system. We wouldn't have enough ventilators for people who got very sick, and we wouldn't have enough healthcare workers to help take care of them. I think the best thing we can do right now is try to keep ourselves safe, to listen to our public health officials, and hopefully flatten the curve.
Dr. Rifkin says this virus also doesn't discriminate against income or profession. He stressed that we need to continue respecting what the public health department says until further notice. Brittany?